Good morning, everybody. I am Danielle Byers with NCC, and today we are going to go through ACA 101. This is part of our skills training. I will remind you this is being recorded, but if you need to ask questions, there's a chat feature, and at the end you can also come off of mute and ask questions. I'd be happy to do that with you. Also, if something happens and you need to drop off, we do have this recorded and it is on our YouTube channel, or you can always reach out to me and I can send you the link. So let's get started. Okay, introduction to ACA. The Affordable Care Act is a comprehensive healthcare reform law that was enacted in 2010 by President Obama. Its main goal was to increase access to health coverage and also to improve the quality while controlling costs. This ACA is called many names, Marketplace, Obamacare, the FFM. It can be sold both on market and off market. Off market just means direct to the carrier without any premium assistance, but both on and off market follow the same law and have all the same protections that were built into the ACA. So, member eligibility. There are really only 4 requirements. You must be a U.S. citizen or lawfully be in the U.S. You must not be incarcerated. You must not have Medicare, that is Part A or Part B, and you must not have access to affordable employer-sponsored insurance. There is a little, well, maybe asterisk on number 4 here, and we will talk about that in a little bit when we talk about the family glitch, and it has to do with what the affordable part of employer-sponsored care actually means. All right, so some key aspects of the ACA law. So in 2025, we have 20 states that have decided to use their own state-based program. Those 20 states require that you certify through them, quote, and enroll through their state websites. The remaining 30 states participate in the federally facilitated marketplace, or sometimes called the exchange. They accept the FFM certification that's found on cms.gov, and you can enroll either through a carrier site, through the healthcare.gov site, as well as through platforms like Health Sherpa. Health Sherpa is what NCC offers. It's not a mandatory choice, but it is what we use. Another part of the key aspects is the individual mandate. While the federal penalty for not having ACA coverage was reduced to $0 in 2019, some of the state-based states do still impose a penalty for not having coverage. Some of those are California, Massachusetts, New Jersey, Rhode Island, and Washington, D.C. But if you live in a state-based state, it's best to check and find out what the rules are for the state. But in the federal locations, that mandate penalty was reduced to 0. Medicaid expansion, that was a huge part of the ACA law when they created it. The federal government expected all 50 states to expand their Medicaid program and provide coverage to low-income individuals. The federal government covered a majority of the costs for states to do that originally, but 12 states still held out and did not expand their Medicaid program. The issue with that is that it left anyone from 0 to 100% of the federal poverty level with the coverage gap. because they do not qualify to get any subsidy assistance towards their premium. But being in that income bracket, they can't afford to pay the premiums to buy the coverage straight out themselves. A great benefit to the ACA law was that pre-existing conditions can no longer be waived. So the ACA law prohibits carriers from placing any kind of waivers or waiting periods on any pre-existing conditions. That means you are covered from head to toe from when you initially enroll in coverage. From the first day your coverage takes place, you are covered. Another thing that it did that's a benefit are the essential health benefits. There are 10 health benefits that we're going to go over that are included in all plans. If a carrier does not have those, they are not allowed to participate in the federal exchanges. It also prohibits lifetime monetary caps and forbids carriers from canceling plans. The only two ways you can be canceled is for fraud or non-payment of your premium. All right, let's talk about those essential health benefits I mentioned. Every ACA plan covers these items. So it must cover doctor's services, in and outpatient hospital care, prescription drug coverage, pregnancy and childbirth, as well as birth control methods. It must cover mental health services, pediatric services, and all of these plans cover children's dental and vision until they have their 19th birthday. That is included as part of the medical plan. All the plans cover preventative care, laboratory services, emergency services, and then rehabilitative or habilitative services and devices. So crutches, wheelchairs, different things that are needed to rehab and get you back to what you were before an accident or an illness. Plan levels, let's talk about these. All ACA plans are broken down into 4 metal levels. Every plan uses these same names: bronze, silver, gold, and platinum. Bronze is the lowest level of coverage, and you can see here from the slide that the insurance pays about 60% of your costs, and as a patient, you're responsible for 40%. As you go up each level, that changes. So silver is a 70-30, gold's an 80-20, and platinum is a 90-10. As you can imagine, the more the insurance company pays percentage-wise, the higher the cost of the premium. So when you are quoting plans through the platforms, you will see the plans broken out into these metal levels and that the premiums increase, but the out-of-pockets decrease based on what level you're quoting. I do have a little note here in the bottom. If you ever see anything about catastrophic plans or anyone asks you for that, catastrophic pretty much went away when the mandate and the penalties for not having insurance were reduced to 0. Catastrophic plans were another level that were designed for any insureds under the age of 30. And it was a way to get them to just buy the bare bones minimum coverages to prevent them from having a penalty. But once the penalties went out, so did the catastrophic level plans. In most cases, you could get a bronze plan with better coverage for a lower premium than the catastrophic. So as the years have gone on, those have gone away just a little bit. All right, let's talk about the different type of networks you'll find on ACA plans. These change based on the carrier, based on the state you're in, but you can always watch for these terms. So the first one we have up here is an HMO. You're probably all familiar with hearing that. HMO stands for Health Maintenance Organization, And those require you to use doctors, hospitals, and providers that are within their network, except in an emergency. But you do need a referral from your primary care to see any kind of specialist on an HMO. The next level is a PPO, Preferred Provider Organization. PPOs offer more flexibility because they allow you to see any healthcare provider, but the plan will pay less if you don't use an in-network. So you can choose to go out of network as long as you're willing to pay, a higher percentage than you would by going in-network. And there are no referrals needed on PPO plans. EPO is a newer term, exclusive provider organization. A lot of carriers now have gone to EPO as a way to reduce costs. An EPO is an exclusive provider organization, and similar to an HMO, it works very similar, but you don't need a referral to see a specialist, but you must use a network provider except in an emergency. So there is no option of seeing out of network and just paying more the way there is on a PPO. The last one that's out there, you don't see these very often, but POS, point of service. This POS type combines the features of an HMO and a PPO. You do need a referral to see a specialist, but you can also see out-of-network providers at the higher cost. So each type has its own advantages and trade-offs, but it is important to consider your customers' healthcare needs and what fits them the best, plus what's available in their area, because in different states and even in different counties, the plan options change. All right, let's talk about premium assistance. You've probably heard me say subsidies today already, but a subsidy is also known as an advanced premium tax credit. You'll see the abbreviation APTC quite often, and a subsidy helps the consumer to lower their premium. It is basically the amount that the federal government pays to a carrier that you enroll with, based on a few things. This is only available on market, but subsidies are calculated based on your resident state, your household size, and your household income. We're going to talk in a couple slides about how that is calculated. But all of those things, household size and household income, are based on how you file your taxes. But subsidy premium assistance is available to individuals and families that fall between 100 and 400% of the federal poverty level. When you run your quotes in either healthcare.gov or Health Sherpa, it will calculate that subsidy for you based on how you answer the questions about income. There is another type of assistance, cost sharing reduction, CSR. Not all families and individuals qualify for cost sharing. Just because you get a subsidy does not mean you get cost sharing, but the quoting system calculates that for you also. But basically, cost sharing reduction is a discount in the deductible, copays, coinsurance, basically your out-of-pocket costs. So if you qualify for cost sharing, you must enroll in a silver level plan to use it. If your customer does not choose a silver plan, they default and lose the cost sharing. It's my recommendation to always show them silver if they qualify for this. Any of you that write Medicare will recognize cost sharing as the same as an LIS, a lower income amount, lower out of pockets. The way it works on Medicare works very similar on ACA. There are 3 levels of cost sharing that reduce your out of pocket costs. So that is too good to pass up on. So I would not enroll anyone outside of silver if they qualify for cost sharing. Okay, household size. Household size is defined as the tax filer, their spouse, and any tax dependents. All of those are included in household size. So these are the basic rules to follow when you're calculating members of your household. So you include your spouse if you're legally married, anyone that you claim as a tax dependent for the year, you count them towards your household size. You do include them on your application, even if they don't need health coverage because they are a member of your household. You just click the box that says they're in your household, they're on your taxes, but they don't need the insurance. If you don't claim them as a tax dependent, do not include them. And like I said just a second ago, even if they don't need health coverage, if they're a tax dependent and live in your household and you're responsible for their care, you include them in that subsidy calculation. Household income, that is part 2. So the household income includes any income made by the tax filer, their spouse, and their tax dependents, same people we were just counting. So basically, the marketplace subsidy is based on your expected household income for the year that you're buying coverage. This is not going off of last year's income. It's the year you're actually covered. So you will count income for yourself, your spouse, and all your tax dependents that are on your tax return. You include their income in the household, even if they don't need the health coverage. This one can be very tricky. If you have questions, please reach out to me and we will talk about that on a one-on-one case basis. But family glitch is something else I wanted to talk about. This pertains to the cost of employer coverage if you're offered it. So under the ACA implementation, rules were issued by the IRS in 2013, and they've been in effect through the 2022 plan year. But a marketplace subsidy was not available if the person had an offer of employer-sponsored coverage that was considered affordable and if the plan provided minimum value. So crucially, only the cost of the employee's coverage was considered when it was determining whether it was affordable. So regardless of whether the employee added their family members to the plan or how much the family rate would be on the group plan, the IRS wasn't looking at that. They were only looking at the employee cost. But fortunately, the Biden administration finalized a new rule in 2022 that's still active now, called the family glitch. So what this new rule the Biden administration passed does is it changed the rule to allow family members to potentially access premium subsidies in the marketplace if the family cost under the employer-sponsored plan didn't meet the affordability guidelines. So anybody that's ever worked with group or been on group, you know there is a huge difference between employee only and family when it comes to your charge through your employer. So the affordability of an employer-sponsored plan is now determined separately for the employee and for the family. If the employee's coverage is deemed affordable, the employee would not be eligible for the subsidy, but the rest of their family could still go to the marketplace and get a subsidy on their insurance plan. All right, let's look at the federal poverty level chart. This is for plan year 2025, and you can see it runs from 100 to 400% of the federal poverty level. So a single person making between $15,650 and $62,600 can still get a subsidy. Of course, on the 100% end, they will get more subsidy than they would if they made closer to the 400, but they can still get assistance anywhere in this chart. So a family of 4 can make up to $128,000 a year and still get some form of assistance. I will be sharing this chart with you guys. I can share any of these slides with you. But this is a good thing to have also. I see a question in the chat here. Let's look. Yes, I will share the chart with you. All right. So let's talk about enrollment. There is an open enrollment period every year, just like Medicare. The open enrollment period runs from November 1st through January 15th. Those are the basic dates. Occasionally, they add or subtract a date at the end based on what day of the week January 15th falls on. The only exception to that is states that are not federal based can have different rules, so be sure to check your own state's requirements. Anyone enrolling during open enrollment must submit their application by December 15th in order to get a 1/1 effective date. That's a really important one. If you're enrolling with an SEP, the effective date rules are different, but during open enrollment, that 1 month, you do have to enroll by the 15th to get a first effective date. Outside of the open enrollment period, enrollment can also be done using a special election period, a qualifying event, a life change. All of those things are triggers for an election period. Most election periods allow 60 days from that qualifying event to enroll for coverage. So anytime during the year, if you lost minimum essential coverage, say you left your job and your employer coverage was going to end on June 30th, if you apply before June 30th, you could pick up a new plan for 7/1 and have no gap in your coverage. But if something happened and you missed that, you would technically have until August 30th, 60 days to enroll in coverage and get first of the next month as your effective date. So while you would have a gap, you could still use your election period to enroll in a plan. All right, these are some special election periods. Loss of minimum essential coverage. That can mean employer coverage, individual coverage, Medicaid. Another one is changes in household. So marriage, birth, divorce, death, taking in foster children, adoption, anything that changes the size of your household can trigger a special election period. Changes in your residence location. So moving, if you leave your zip code and go into a new zip code or county, that gives you an election period. And then the last one is an employer offer of coverage. So if your employer offers to help you with the cost of individual coverage, you can use that as an election period to enroll. Okay, let's talk about our enrollment platforms. I've mentioned these a few times. So there is the marketplace, which is healthcare.gov. Anyone that is a federal-based state, you can enroll for them on healthcare.gov. We provide a link and training for Health Sherpa. Health Sherpa is a great platform. It is synced to the marketplace. So each day when you log in, you link your account to the marketplace. That allows you to still see all your customers on the marketplace. It allows you to pull up existing customers on the marketplace and have their application and all their information flow into your system to help you. That is especially helpful in open enrollment when people are shopping for plans. It helps you to not have to type all their information in the system again. And then I mentioned earlier, but all of the carriers also have their own platforms you can use. The one negative to using a carrier platform is that you only see that carrier's options when you're running a quote. So you wouldn't be able to see any options from any other carriers to find out what would be the best plan for your member. All right, these are some areas of focus. Anyone that sells Medicare knows there are many, many rules with Medicare. You cannot cold call. You cannot go door to door. You cannot hold same-day appointments. You must have a signed scope of appointment that is permission to contact. In most cases, you need that 48 hours in advance. And also to sell Medicare, you are required to complete AHIP training and each individual carrier's certifications. There is a charge to take the AHIP test, and also if you request the CE credits for the time you spent taking AHIP, there's a charge for that. On the ACA side, there are not as many regulations, so you can cold call. You could go door to door. You can hold same-day appointments. You do not need permission to contact someone. The only thing you must do on an ACA plan is you must collect and maintain a consumer authorization form. That form gives you permission to enroll the member into the marketplace. So you don't need that ahead of the quoting process, but you will need it for anyone you're enrolling. You, as the agent, are required to maintain that authorization form for 10 years, very similar to the scope of appointment. But to do the ACA, there is only one certification required. There are no carrier certifications, and all certifications in the states and the federal are free. So if you're selling in a federal state, like we mentioned, there's about 30 that are federal. There is one test found on cms.gov, and it will cover you for all of those states. There are 20 that are state-based, so states like Georgia, Kentucky, New York, New Jersey, California, Arizona. There's a list of them I can show you if you need it. But they each have their own certification you must do, and then you have to enroll and quote on their website also. All right, so let's talk about some complementary products that work well and go with Medicare sales and ACA sales. So cross-selling allows you to round out a member's account. It helps you because once you build a relationship with someone, it instills trust. They know that you're their insurance person. You have different products you can offer them. There is a 60 to 70% probability that you will sell a second or a third product to a client that is already on your books, as opposed to only a 5 to 20% of making a new sale to a new client. So make sure you reach out to your sales development managers if you're not already contracted for these. But NCC has dental, vision, hearing. We have life and final expense. We have ancillary plans, hospital indemnity, disability, critical illness, short and long-term care, accident. There are so many plans out there. We even have indemnity plans that work with the ACA. So reach out. All the sales development managers can help you with those. Another thing we have are ACA alternatives. So not everyone wants to go on the ACA. Not everyone has an election period to buy, and they have to wait till open enrollment. So you can also ask your sales development manager about some of the alternatives we have. We currently have one share, which is a similar to a MediShare plan. We have Arch and we have short-term medical. And we're in the process of bringing on a couple more options. So if you have somebody that needs insurance but doesn't have an SEP to get into an ACA plan, or just doesn't want to be on an ACA plan, please reach out and let us tell you a little bit about the alternatives that are out there. All right, so I want to talk a little bit about some sales opportunities. The ACA was created for people who didn't have the availability of an employer plan. So 1099 employees, gig workers are very common nowadays. People who run their own business and are self-employed with no employees. If you work freelance or consulting, that's hairdressers, real estate agents, lawn maintenance companies. There's so many businesses out there nowadays that are not W-2, they're 1099. I do have hotel staff and restaurant staff up here. Those aren't always 1099, but technically we find that a lot of them don't work enough hours to be considered full-time, so they're not offered employer benefits. They are also a great market. We can help you, our marketing team can help you create brochures. And you can go out and leave your information with a lot of these different types of businesses. Ask if you can speak to their employees. Ask if you can leave materials and be a referral source for them. There are great agents' careers built working, just specifically with one. I have someone that works with trucking companies. I have another that targets hair salons. So kind of find your niche that goes back to your natural market. But there are always things we can do to help you with that. Another thing for agents are referral partners. There are a lot of financial careers that have nothing to do with insurance, but they speak about it to their customers. So CPAs, tax preparation companies, even financial advisors, property and casualty insurance agents. A lot of those don't do health insurance. So when their customers come to them, they need someone to refer people to. These other two things I have on here, help on demand and find a local agent. Those are two lead options that are available through the marketplace. When you certify to sell ACA and you create your profile, it will ask you if you want to participate with help on demand. Help on demand is people that are on the marketplace that ask for help. They will automatically transfer calls to you through help on demand. The other is find a local agent, and that will list you as a certified agent selling ACA, and people can search by their county and zip code and find agents in their area. These are both free, great ways to get some leads coming into you also. All right. This is my contact information. If anyone has any other questions, let me look at the chat and see. Does anyone have any questions? You can pop them in the chat, or you can take yourself off mute and just ask me questions. I'm happy to help. Well, I hope everyone enjoyed this. I hope you learned something, or maybe triggered some extra questions you want to ask, piqued your interest in ACA. It is a great thing to have in your back pocket. It works very well with the Medicare sales. So many times you go to help someone turning 65 and their spouse is younger. You run into so many families now where, say, the grandparents have custody of their grandchildren and have to keep them on an ACA plan. Just so many things out there, so many people asking, and you never want to turn away business or send your customer to work with another agent. Those aren't always you don't want to lose everything you have with them because they went and worked with someone else when it's something you could offer them and help them with. So please reach out to me, reach out to your sales development manager, and we are here. We're happy to help you.